Let's talk about exercise considerations, how to protect your pelvic floor, how to protect your body when you're in that third trimester of pregnancy. Coming from a pelvic floor physical therapist assistant, that's me. My name is Oriana. I'm in my third trimester currently at 31 weeks. And these are things that I am doing with my own body and that I have all my patients do to protect their body when they're going through that third trimester. So what are some things that we need to consider when it comes to the body during that third trimester? Well, when it comes to hormones, your testosterone is actually at its highest. So this is a great time to build up some muscle strength, which you're going to want to use, first of all, to keep everything stable around your pelvis as your uterus gets bigger. Helps out with that back discomfort. But also it's going to help you out whenever you are postpartum. It'll help you better with recovery whenever you're postpartum. It will help you just have the muscles that you need in those first few weeks after you have babies. So that's going on hormonally. You also really want to focus on building up endurance, learning how to relax your pelvic floor muscles, learning how to just do mechanics that you're going to need while you're pushing, and learning how to continue keeping your posture intact so that way you're not uncomfortable and getting shifting through your pelvis that's just uncomfortable, getting that low back pain, things like that. So it's a lot of being everything that we've built up so far in that first trimester, second trimester, working on that posture, working on those breathing mechanics, make sure that you're exhaling with every single thing that you're doing, and then also trying to build on that can help you out with your labor and your postpartum journey. Now, before I give examples of exercises and the reasons why we want to do those exercises, I want to mention one thing about strength training versus cardiovascular endurance. We want cardiovascular endurance, excuse me, we want that cardiovascular endurance during labor because labor can be long. Maybe for some women it's short, they have the really short labors, but the majority of women, it's going to be that 8 hours, 12 hours, 24, 40. It's going to be a long labor. And so having that endurance to handle those contractions every few minutes is going to be really, really important. It is like a marathon. And whenever you're strengthening and your heart rate goes up, some women will, or some people, just everybody, will think that is cardio training. That is not cardio training. That is just your heart handling the load of strengthening as it is strengthening out those muscles. Cardiovascular endurance training is going to be going on nice long walks, doing the same repetitive motion for a really, really long time. That's going to help to get your heart rate up. So personally, I like to go walking up and down hills, and walking up and down hills is actually really beneficial for your pelvic floor at the end of your pregnancy, which I'll do in a birth prep video. So walking up and down hills is great for that cardiovascular endurance training. You can go running if you're feeling supported, if you're using a belly band and tape over your belly, things like that. I don't usually recommend that for the majority of my patients based off of how they present to me, but if you're not having any pain, then it's okay. If the doctors say it's okay, then it's okay. But doing things where it's just that constant, maybe even doing the stair stepper or something like that, that's going to be that cardiovascular endurance that you will benefit from during labor. Now, exercises that we're going to want to work on are going to be to try and help the bones just be able to move the way that they should move during that labor portion, but also just stabilize so that way things aren't shifting too much. A lot of women in their third trimester will start to talk about having discomfort, that pubic symphysis discomfort right at the groin. They'll talk about having that SI joint pain. They'll talk about being really, really, really stiff and really tight through the back of their hips. So these activities can help to negate those things. If we strengthen out the lat muscles attach right here through that sacral tissue, right? If we can strengthen out those lats with pulling down motions, then that's going to help the sacrum move a little bit more during labor, and it also provides just postural stability during your pregnancy. If we strengthen out the hamstrings, so the body moves through more of an anterior pelvic tilt at the end of pregnancy, so this is a neutral position. This is going to be an anterior pelvic tilt. Whenever it moves through that anterior pelvic tilt, then it's going to put the hamstring muscles that attach right here, the back of your leg muscles, it's going to make those muscles longer. And so we want to actually strengthen out those muscles so that we can give your pelvis some more support. That way it doesn't curve so much and hurt out your back. We also want to be able to do hip internal rotation because the majority of women at the end of labor walk like a duck with their little waddle like so, and their toes are pointing out as they do that. So that's going to be that external rotation. We don't really want that external rotation so much. It's going to happen a little bit, but we want to decrease it a little bit. So we want to do more internal rotation activities. So we're going to be closing down on that hip rather than opening it up. So if you do squats at the end of your pregnancy and your toes are way far out, that might be uncomfortable. So there's that. Of course, we're going to want to work on more core stabilization. The diastasis is going to start to separate quite a bit. The diastasis being that abdominal separation that happens that is 100% normal and okay. And so since it's going to be happening here, we want it to happen just a little bit if we can help it, right? We want to make sure that our belly isn't sagging really, really low. And so if we do activities where we are rotating in, then we are helping to close that out. That's also going to help us out with that hip rotation that we talked about. And then also if we just work on that transverse abdominis activation, we are going to help to keep that core stable. So all of these are going to be really, really beneficial for that end of pregnancy discomfort and for just preparing the body for labor. The other thing is that you do have to pull a lot during labor if you're pushing on your side, if you're pushing on your back, which I will talk about in a birth prep video. But if you're pushing in these positions, you usually do pull your legs, and you want to do it with the forceful exhale. So we're going to talk about how to do that as well. Now I'm going to use this little stick. It's actually like a little broom sweeper guy to show you how you can use tools within your house in case you don't have a lot of equipment. And we want to work on that lat strength, like I mentioned. And you get lat strength by doing like pull-ups, you know, or by doing pull downs, like you're pulling a cord down. But if you don't have that at home, then another way that you can do it is by taking a stick and pushing it against your leg. And when I do that, if you can see me from behind, when I do that, I immediately feel this engage a little bit. And then getting the hamstring, so it's a little double whammy right here, I'm going to push into my legs, feel that lat engagement, and then do a little RDL or a hip hinge like so. And then you're going to go up and down. And the goal is to keep your body neutral. So a lot of women are here, and then they go like this. So it's not really helping you out there. So you want to be in that neutral position in your low back. Pull down. Inhale as you go down to lengthen that pelvic floor. Exhale as you come back up. Like so. And then if that feels good, then you can add in load. And if you want to, I really do suggest getting something like a sport cord or like some sort of like resistance band with that you could pull down, because then you can tie it up onto your wall and then go ahead and pull that down to get more of that lat engagement against resistance as the testosterone's high, and we want that. Moving on into some rowing, and this does get your lats a little bit. You can do a bent over row. So you can grab something heavy, grab some dumbbells. I like the adjustable dumbbells that you can get pretty affordable online. And then you would put your hands down with something, exhale as you come up. And if you feel like your abdomen is kind of like pushing out, if you feel like you see a little alien coming out, you just feel like there's a lot of pressure through your belly, then you want to do it on an even higher surface as you pull and getting that shoulder blade to move back behind you. Now moving through that internal rotation, so that would be on this leg right here. Let's see how I'm going in towards it. You can do that with load, going down a little bit and then coming back. And when you're doing this, you are going to be hinging at your hips, going down a little bit and then coming back up. And you want to, I like to be in a little single leg toe touch position as so, but you can have your feet staggered, or if that's really hard, you can have your feet together as you go down and then come back up. But you're just trying to get that internal rotation in and then back out. I like having the band up here because it gives me a little bit more resistance for my legs, but that's also optional. You don't have to have that. Next up is taking a heavy weight. It could be the same dumbbell, just something heavy that you have in your house, and then doing some rotational core strength. So, because whenever I rotate, and I'm trying to bring a rib down, it helps to stop that rib separation that naturally is going to happen, and that's okay. But it helps to decrease how much that's happening, so that way whenever you're postpartum, that can just help you out. So exhaling while dropping down. And you see how I'm twisting, but I'm not doing like deep, crazy twists. I'm just trying to think about rib down. You can try it with both legs. If it is really uncomfortable for you to have your legs split like this, then you can actually do it standing on your knees or just standing on your feet. Same thing, and you're exhaling as you're doing it. Now moving on into some transverse abdominis core, that deep, deep core muscle. You could take an exercise ball that you should have at the end of pregnancy because you're going to be using it a bunch, especially during labor, to try and stimulate labor, to try and make yourself comfortable at the end. You're going to go ahead and grab that ball, and you can push into that ball. Now, I personally, I would like to do it at a wall, but to be able to show you, I'm going to do it here on the floor. But to keep that abdominal separation from happening too much, it might feel better to start it off at a wall, especially if you feel like your core isn't as strong as you'd like it to be. But here at this little table, I'm going to push into it as I exhale. So it'd be, and I can feel my core activate when I do that. And I'm making sure that there's no coning, so you shouldn't be able to see any coning present. Coning meaning that that little alien pops out. You shouldn't be able to see that, so we'll try again. And yeah, I feel my core with that. Another important thing is that you want to breathe through your lat. So we talked about the lat muscles, how the lat muscles go like through this little tissue right here. And so thinking about breathing properly whenever you're doing core exercises and doing these weighted exercises, I like the cue to breathe through your lats. And I feel like it feels so good whenever you are doing something heavy, like you have to pick up heavy groceries or you're trying to work out. Whenever you're doing that activity, you're taking a deep breath in through your lat. So, and then exhale through your mouth. So now the pressure is going through your back rather than down through your pelvic floor or your core when you're trying to get something going on. And the last thing is working on that postural control with some functional movements. Like if you have to walk upstairs, you should definitely practice walking upstairs while maintaining correct posture, right? If you have to carry a heavy toddler, you should practice carrying that heavy toddler with correct posture. And another thing that we do often is get up and down off the couch, up and down off of a toilet, for example, get in and out of the car. So you want to practice that as well. So you can go hold onto something heavy, find that neutral position, breathe in through your lats, exhale as you squat, and notice how my hips go back as my knees go forward. A lot of people will do what I call like the elevator squat, where they'll go like this. That's not going to help you out. You want to get the hips back, knees forward, and your toes can go out just a tiny bit for this, not too much. You don't want to be super duper like duck feet. You can't see my feet right now, but you don't want to be super duper duck feet. But toes forward a little bit, and then going down and doing a few rounds of that. I'm officially out of breath, but the last part of this video is preparing the pelvic floor for labor. So everything that we just did may upregulate the pelvic floor tissue. It may make the pelvic floor tissue get a little bit tighter, and that's okay if it's giving your pelvic floor the support that it needs. But towards the very end of pregnancy, we want to make sure that the pelvic floor can also relax, especially during that last 6 weeks or so. So the other thing that you're going to do is work on, if you're not doing it already, you're going to do perineal massage. And I have videos of this up on my TikTok and Instagram. But perineal massage is where you go in through that perineal tissue, and you're gonna go ahead and pull down at different angles. You're gonna hold it for like 5-6 deep breaths. You can use a pelvic floor wand to do this, because I do find it really hard to do on myself with my own thumb, but when I use the wand, it's a lot easier. But you want to start to stretch out that perineal tissue, because it can take 6 to 8 weeks for the tissue to want to adapt and change. So you definitely want to start that. If you're going to have a baby at 40 weeks or at 36 weeks, 37 weeks, you definitely want to start that perineal massage earlier. And the other thing is that all of these muscles that are in the pelvic floor, if we move our pelvic bones, it means that we stretch the pelvic floor muscles. So if I do little like movements with my pelvic floor, I'm going to be stretching out all the muscles that attach through these different spaces. So we're going to do that right now. So one of my favorite, easiest ways to help stretch out that pelvic floor tissue is by putting your knee onto a block, shifting your weight over that knee, and then doing little pelvic tilts. You can do pelvic tilts in different directions, or not different directions, but however many reps you want to do. You make sure you do both sides. You can shimmy your hips side to side, so it's kind of like I'm wagging a tail, right? You can do little like rotation, where I'm kind of just lifting one hip up, so it looks like my weight is over here, and then if I move my hair, my weight is over here, and then I am lifting my hip up and going back down. So that's going to give me some of that rotation. So you could do that. You could do little rotations where you're literally just doing little pelvic rocks like that. So you're kind of getting all the different directions. You're just getting mobility through that low spine. I love that. You can sit down on an exercise ball, especially if you're like me and you have to be with the toddler a lot, out on the floor a lot. You can grab a little lacrosse ball. You can sit on it right behind your sit bone, so right behind that little bony part. Whenever you sit down onto the side of your labia. by your tailbone area, you can go ahead and put a ball there and then breathe while you're sitting on that ball. All of those things are going to help to relax your pelvic floor, which we want to do for the end of labor. This is definitely my longest video on my YouTube channel, but that's how much energy I feel like the third trimester needs. You're giving a ton of energy. You are using up so much energy. It is so much work on your body, and you probably are still trying to function in the rest of your daily life as well. So you're killing it. These are ways to try and help your body. I am so lucky to have worked in a place where I get to do these things for a living. And so the pain that I experience is extremely minimal, if at all, right now in this pregnancy, based off of like everything that I've been able to apply before getting pregnant and during all the different trimesters. Your pregnancy does not have to be uncomfortable. I've seen many women in the third trimester come in so uncomfortable, and not all of them, but a lot of them feel so much better even before they give birth. So just know that movement is truly medicine whenever it comes to your body. Protecting your pelvic floor can be so beneficial whenever you're giving birth, and all of that combined can help out with your postpartum recovery. You should be getting pelvic floor PT at this point in your pregnancy if you're not already. And if your provider is saying, no, I can't give it to you because you need to have the baby first, that's not correct. That is wrong. We bill the same as any other physical therapy, so that's a whole different video that I can go over. But you should definitely be getting pelvic floor physical therapy. So good luck to you in your third trimester. I hope that these little movements can make you feel comfortable and that they can make you feel more confident in choosing your exercises at the end of your journey. And I look forward to seeing you whenever we do the birth prep video, where we go over different things to consider to continue protecting your pelvic floor. All right, thanks. Don't forget to like, comment, share. Just say whatever it is that you want to say. I'm still new to the YouTube thing, but I enjoy doing it. So I'll see you in the next one. Bye.